3 deep breaths. Normal breath. Awareness of air rushing in and out of the nostrils. Sensations inside walls of the nostrils. If the mind wanders, begin again. Allow your eyes to rest as you are aware of the air going in and out of your nostrils. Relaxed face. You're not doing breathing. You're being present as the breath is happening. Palms to the heart center. Namaskar Mudra. Thinking of someone that you love and respect. dedicating all the benefits from this session to that person. Chin to the chest. Opening your eyes. Inhaling, arms by the side, pressing the palms, looking up. Exhaling, hands coming down, looking down. Inhaling, exhaling. Inhaling, exhaling. Inhaling, exhaling. One more round. Inhaling, exhaling. Release. Come up to standing. Feet hip width apart. Arms up, interlacing fingers, palms facing up. Inhaling, coming up onto the toes. Exhaling, heels down. 4 more rounds. After completing, release your arms. Take a deep breath, exhale. Arms up, interlacing fingers, palms facing up. Inhaling center, exhaling, laterally bending toward the right wall. Move your left hip toward the left wall. Inhaling center. Exhaling, bending toward the left wall. Inhaling center. 4 more rounds. After completing, release arms. Take a deep breath, exhale. Arms up, interlacing fingers, palms facing up. Inhaling, moving your hips forward, take your arms back, gently look up. Exhaling, straightening up. 4 more rounds. After completing, release the arms. Take a deep breath, exhale. Arms up, interlacing fingers, palms facing up. Inhaling, Utkatasana, bend your knees, sitting back in an imaginary chair. Exhaling, straightening up. 4 more rounds. After completing, take a deep breath, exhale. Arms up to the sides, parallel to the ground. Palms facing the front. Inhaling center, exhaling, twisting to the right. Inhaling center. Exhaling, twisting to the left. Inhaling center. 4 more rounds. After completing, release arms. Take a deep breath, exhale. Front of the mat, Tadasana. Exploring the edges with your diligence and being present for the flow of experience, which is to be present to your own body sensations, breath, and emotions. 3 rounds of Surya Namaskara practice begin. No aggression at all. Conscious movements without aggression. If the mind wanders, begin again, being present. After completing, sitting in Sukhasana, palms facing up, eyes closed, allow the breath to normalize. Being present as the breath normalizes. Three deep breaths. Gently opening your eyes. Since there are only a few people on the session, we can pick, or you can pick, the postures that you would like to practice. Any of you have particular preferences, want to explore certain postures, please share.
I have a little bit of back pain.
Yeah.
Maybe some yogasana to reduce the pain would help.
Okay. Back, where in back, Santo? Lower?
I think upper, Jay.
Upper? Between the shoulder blades?
Oh, sorry, lower.
Lower. Okay. Lower back. Okay. Yeah.
Even
Thank you. Thank you, Santo.
same for me there, Jay.
Okay.
It will
Okay.
be.
Vinny. Okay, Vinny. Others? Any postures that in particular? Yes. Go ahead, Nageshwar.
Mm. Strengthening, knee strengthening, just to avoid the noise when we are moving.
Okay. When you're getting the noise, does it hurt?
No, it won't hurt. That's what even doctor told me. As long as it is not hurting and swelling, you are fine.
Yeah. Yeah, my knees also are making noise, but the doctor exactly said the same thing. But yeah, knee strengthening, that's good. Any other postures? Irama, Sachin.
Anything is fine.
Okay, Sachin.
Anything, any asana is fine, but I'll be interested in that halasana approach.
Halasana.
Yeah.
Okay, okay, Iram. Halasana requires an entire session. Another session, I'll remember Halasana. We'll have to prepare.
Sure, sir.
May I ask why Halasana, Hiramma? Any particular reason?
No particular reason. I wanted to try that.
Very good. Very good. Yeah, we will get there sometime. Thank you. Come up to standing. Feet hip width apart. Utkatasana practice, we are going to hold in a way that you can strengthen the thighs and protect the knees. When in Utkatasana, make sure that your seat bones are going back rather than the knees bending forward in front of the toes. Keeping the back straight as much as you can, alignment with arms, almost a back bend. See if you can gently reach a back bend in Utkatasana, gentle back bend, not far too much. And then lean forward enough to bring balance on your feet. The weight is distributed between your heels and the toes, even as the seat bone is going back and you lean from the hips up. Feet hip width apart, toes pointing directly forward, arms up. Interlacing fingers, palms facing up. Inhaling, Utkatasana. Look down, you should be able to see the big toes. Lean forward further if you need to bring more weight onto your toes. Keep taking your seat bones back. 3, 2, 1. Inhaling, straightening up. Exhaling, release. Nageshwar, if you are feeling the posture on your thighs, you're okay. If not, unmute and tell me where you're feeling the posture.
I get little jerk on knees.
Jerk on knees. Is it okay if you come on video?
Yeah.
Hey, Sachin here. So in
Yes.
Utkatasana, where should we feel that stretch? On our hamstring?
Not stretch, you will feel the load on your thighs.
Not on, we should not feel anything on hamstring, like if it is
Hamstring,
this
hamstring is
thigh.
not working much. Your upper thigh, the quad muscles are working. Oh, you will feel the stretch in your hamstring if you're trying to get your back to straighten up too much and you're gently going into a back bend, you can feel that.
Yes. Oh, okay.
So, Jay,
So
I
focus
have
is on quad.
Focus is on quad, yes. Focus is on quad by taking your seat bones back. Nageshwar, turn sideways. You turn sideways, yes. And yeah, now let's all practice. Yes, that's better. Feet hip width apart. Arms up. Interlacing fingers, palms facing up. Utkatasana. Inhaling Utkatasana. Exhaling, straightening up. Release the arms. So, Nageshwar, were you having more weight on your toes or your toes and heels even distribution?
Even distribution.
Okay. And how was the knee feeling?
Knees, first time I get the pain, then it will be all right, kind of thing.
Okay, yes. A little bit of a load, and the load will come from the thighs over the knees. Or the muscles go over the knees to the lower leg, and you would feel the muscle, or you can become aware of the muscles that connect from the thigh bone over the knees into the lower legs. So we're going to hold the posture for 10 counts. Yes,
So Jay, I
Vinay?
wanted
Yes.
to just tell one thing to Nagesh. Actually, a few years back when I started, that time I was also whenever I used to do Utkatasana. So instead of getting the pressure on the thigh, I used to get in the knee. Then slowly I learned what mistake I was doing earlier, like this, straight, like I'm just bending. This is putting the pressure on my knee.
Hmm.
But if I will do like this, first I will little bit I will take my C-bone back before bending down.
Yeah.
And instead, if I will directly sit, then the pressure will be on knee. But if I will just C-bone, I will little bit I'm taking out and then I'm sitting, then full pressure on the thigh. This I have learned, Jay.
Very well.
Just
Excellent. Excellent, Vinay. Thank you so much. A little bit of a forward tilt of your pelvis or hip, and then that allows you to sit further back. Nageshwar, I'm not sure if Vinay's instructions, beautiful instructions, were helping. You can try that now. First,
Okay.
tilt your pelvis to the front, meaning you're taking your seat bones back even while you're standing straight, and then you're bending the knees. No, before you bend, no, straighten up. Before you bend your knees, arms up, arms up, arms up. Before you bend the knees, tilt your pelvis forward by taking your seat bones back. Seat bones back as in towards the back, and then start bending. Yes. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Inhaling, straightening up. Exhaling, release arms. Allow the breath to normalize. Utkatasana is a standing cardio. Heart rate could increase, breath quickens, perhaps. The big muscles, the thigh muscles are working. So the heart is needing to work to pump more oxygen to the thighs and take the waste out. A variation of this, find a wall and stand with the wall against, or your back against the wall. Keep your shoulder blades against the wall. Feet hip width apart. Take a deep breath, exhale. You can even have your hands on your hips, your shoulder blades are on the wall. Slowly walk your feet half a foot apart and then slide down. Slide down the wall. You're keeping your entire back and hands can be on your hips or hanging down until if you can bring your thigh parallel to the ground or close to it, your knees on top of your ankle. Keep sliding. Santo, yeah. Bend your knees and slide against the wall. Yeah, your knees are against your ankles. 5, 4. You should feel the posture in your thighs. 3, 2, 1. Inhaling, straightening up. Release arms. This is wall supported Utkatasana. Come back to the mat. These postures are easily accessible. You don't need a lot of space. Take a deep breath, exhale. Let's pay attention to the lower back. Lie down on your stomach. Makarasana. Santo and Vinay, do you feel any discomfort in your lower back in Makarasana? If no, give a thumbs up. If yes, come and tell me thumbs up. Okay, then Makarasana comfortably. Santo, when you're bending the knees, that's okay, and that is what is called Karna Pidasana. You just bend your knees. Makarasana is not bending the knees, just separating the legs. Toes, by the way, legs can be off the mat. Toes can be pointing away from each other toward the walls. If that is not with your inner feet on the mat or on the ground, if that is not relaxing your lower back, then you can have your toes point toward each other or toward the back wall. Take a deep breath. Let's practice Bhujangasana variations. Bring your legs together. Toes pointing to the back wall, chin down, palms by the sides of your chest. Elbows pointing to the back wall. Inhaling, chin up, head up, chest up. Not much weight on the palms. 5. Deep breaths. 4. 3. 2. 1. Makarasana. We are trying to use the back muscle strength, and this also increases the lumbar curve. The lumbar region of the spine curves toward the front of the stomach. When we are sitting in our chairs normally, when we slouch and we sit, this lower part of the spine straightens up and is not in its normal shape. When we slouch, the lumbar curve straightens up, and instead of curving to the stomach, toward the stomach front, it curves or straightens up towards the chair. And this causes, or this could cause, the discs to be in strain for a long time. The disc is a cushion between the vertebrae of the spine. Now, Bhujangasana strengthens the muscles around the spine on your lower back to keep the spine in its normal curve, which curves towards the stomach. Let's practice this one more time. Bring the legs together, toes pointing to the back, palms by the sides of your chest, chin down. Use your back muscle strength to inhale and come up in Bhujangasana. Relax the legs. Legs are relaxed. Palms not carrying much weight. 5 deep breaths. 5, 4, 3, 2, 1. And release. Makarasana. Relax. The lower back spine is constantly carrying weight of the upper body. And the discs between the vertebrae, the spine bones, are constantly under more pressure, carrying the weight of the upper body. So it's important to take care of the muscles that protect and activate the lower part of the spine. And Bhujangasana is to strengthen or activate the muscles around the lumbar curve. Take a deep breath, exhale. Now we are going to do variations of Bhujangasana. Bring the legs together, toes pointing to the back. Chin down. Take your arms close to the body. Straighten up your arms close to the body. Interlacing fingers on your back. Now your shoulders are off the mat. Chest is pressing, chin is pressing down. Legs together, toes pointing to the back wall. The legs might try to get into the posture and help, even if initially when you come up, the legs are recruited. See if you can relax the legs so you can get your lower back muscles to work harder. Inhaling, chin up, head up, chest up. And take your hands toward your heels. No jerky movements, conscious movements. And feel the lower part of your back working. 5, 4, 3, 2, 1. And gently release the chin down, Makarasana. Sometimes the lower back muscles get more strained when the upper back muscles are not strong enough. And so they compensate for the upper back muscles. So let's pay attention to the upper back muscles. Feet hip width apart. You can even keep your toes tucked in. Stretch your arms to the sides like a T. Inhaling, chin up, head up, chest up, arms up to the sides. And you'll feel that your upper back muscles also working. 5 deep breaths. 5, 4, 3, 2, 1. And release the posture. Makarasana. Your leg position. Change the leg position enough to get a relief to your lower back. Take a deep breath, exhale. Bring your legs together. Another variation of this, combining lower back and upper back. Stretch your arms toward your legs, palms facing down. And your palms may be a little further away from your body. That's okay. Inhaling, chin up, head up, chest up, arms up, palms facing down. 5 deep breaths. 5, 4, 3, 2, 1. And release. Makarasana. Relax. We are using gravity to activate the back muscles. Stretch your arms to the front, chin down. Bring your legs hip width apart. The arms can be like in a V shape. Instead of going straight to the front, chin down. Toes pointing to the back wall, but hip width apart. Now, feel the posture on your upper back and lower back, especially around the shoulder blades and even the top of the shoulders. From the neck to the shoulder, you can feel. Inhaling, chin up, head up, chest up. 5 deep breaths. 5, 4, 3, 2, 1. And release. Makarasana. Roll on to your back. Legs together. Relax the feet. Bend your knees, feet flat on the mat. Bend your knees, feet flat on the mat. This will give even more relief to your lower back. Hug your knees, rock back and forth, massaging the entire spine from the lower back all the way to the top of the back. Side to side. Settle back down. Surrender in Shavasana. Shoulders away from the ears. Legs comfortably separated. Feet falling to the sides. Arms a bit away from the body. Shoulders totally relaxed. Jaws relaxed. Eyeballs relaxed. Hips, knees, ankles relaxed. How wonderful it is to be alive and aware. How fortunate it is to be present for this breath. Observing your breath around your abdomen. Totally relaxed. Relax. Relax. Shanti, Shanti, Shanti. Gently coming out of Shavasana, coming to a meditative posture. Take your time. Taking your hands back, inhaling, growing taller, exhaling, bending forward, thanking Mother Earth. Inhaling, coming up, rubbing your palms, vigorously generating heat. Massaging your closed eyes and gently blinking your eyes open. Namaste. Thank you all so much for giving me this opportunity. Have a good evening. Good day ahead. Thank you, and happy holidays and happy New Year. Thank you.
Thank you,
Thank you,
Jay,
Jay.
sir.
Happy
Happy
holidays.
holidays.
Thank you.
Thank you, Jay.
Thank you so much.
Happy holiday, Jay.
Thank you.